right now. There we go. Okay. Thanks for sharing, everybody. We are happy to have Ashley, Corinne, Haley, and Christina here to speak with us today. They're all moms to O babies and are looking forward to sharing their stories with you. So they'll be telling us a little bit about their experience with their diagnosis, their pregnancies up through birth, their NICU stays, and how their babies are all doing now. After we hear from each of them, we'll open it up to questions from everybody else here. Before they start, I just want to remind everybody that no one here is a doctor and we are not providing any direct medical advice to you today. These moms are here to share their personal experiences with all of us, so please direct any medical questions to your own providers. All right, Haley, I think you are going to start us off.
All right. Hi, everyone. I'm Haley. I'm 28 years old and a first-time mom. When I went in for my 10-week scan, I had my husband, Caleb, and my little sister, Hannah, in the room with me. She's a nurse at the office where I got all of my scans. I remember the look on her face as she was checking her phone. I knew something wasn't right. The ultrasound technician had sent a message to their office that maternal fetal medicine was needed and they were going to be behind on scans for the day. At 10 weeks, I was told about this phenomenon that occurs to every baby in the womb. The organs that have already developed push through the umbilical cord, twist, and then return back into the abdomen. I was told that there was a possibility that this is what they could have caught on the scan, but we would recheck at 13 weeks. At 13 weeks, we went back in and received the diagnosis of our baby girl having an omphalocele. She had her liver, gallbladder, and partial bowels in her O. I hate thinking back to that day and reliving what doctors were telling me. My maternal fetal medicine doctor was extremely positive and optimistic, whereas my OBGYN kept reminding me that I could terminate my pregnancy. Safe to say, I stuck with my maternal fetal medicine doctor and haven't talked to that OBGYN since. I went in for scans monthly, had NIP testing, echoes, and an amniocentesis. All came back normal, so we were dealing with an isolated omphalocele. As we got closer to my due date, I went in weekly for scans to monitor our baby girl. We knew that I would be delivering our girl via C-section, so we had a scheduled date for July 11th. July 11th was the most beautiful day of my life. At 11:08, I heard the most amazing high-pitched scream, and every anxiety that I had went away. They took Miller up to the NICU immediately, and we were constantly reassured that she was a strong, healthy little girl. I was not able to go see Millie until later that night. I was fully prepared to not hold my baby, as that is what something the NICU team, the pediatric team, and my doctors preached to me throughout my pregnancy. The moment I was wheeled into her room, the nurse looked at me and asked if I wanted to hold her. I knew from that point on, Miller was a strong little warrior, and our journey was going to be such a positive one. We spent 9 days in the NICU, and I spent 3 days in labor and delivery. We made sure we were in the NICU every morning for rounds. I asked a total of 1,010,000 questions throughout our NICU stay, and as annoying as I felt doing so, it allowed me to feel confident in our decision-making. After 9 days of driving to and from the hospital, we were finally able to take Millie home with us. We met the most amazing surgeon who has been with us since our NICU stay. To say he has been the biggest blessing in our lives is an understatement. We went in monthly to see him, but he was always available to answer any of my questions via email. He also called us weekly to check in to see how wrapping was going, how our eating was. That can be a struggle. And also to check in on me and her dad. Our journey would not have been as easy as it was without having Dr. Franz by our side. Mills had her surgery on Leap Day this year. She was 8 months old. We spent months wrapping her omphalocele, applying compression, and growing skin to get to a point where we were all comfortable with surgery. Her surgery lasted about 2.5 hours and was easily the longest 2.5 hours of my life. We spent 3 days in the hospital with Millie following her closure. Day 1 was pretty rough, but after that, you would have never have known that she had a major abdominal surgery. She was back to smiling, talking, and moving around in no time. Millie has truly lived a normal baby life since we brought her home. We took her to the river. A week after being discharged from the NICU, she came to all of the family parties with us. We went on walks. These were all things I was told not to look forward to. But I want all the new moms and families to know that living a normal life with an O baby is absolutely possible. You've probably read it on the mood page before, but these O babies are fighters. They are small, but they are truly miracles. I wouldn't change a single thing about our journey, and I'm so happy I'm now able to help provide support for new O moms and families. I wouldn't have been able to get through our O journey without my husband, Caleb, my mom, both of our families, Dr. Franz, our surgeon, my doctor, Dr. Bender, our faith, and our sense of humor. Thank you, guys.
Thank you, Haley. You've got a strong little one there. All right, Christina, you are next.
Hi, I'm Christina. I'm from Massachusetts. I live in the western part of the state with my husband Ryan and our O baby Elliot. He's our first child and our only child. And like Haley, I went in for a routine scan at about 11 weeks. And unfortunately, no one told us at that scan what they had found. I found out through my portal the next day, my patient portal, that there was an abdominal mass found, and that it was unidentifiable to them at that point. I had to fight pretty much that whole day, that whole following day, to get in touch with my OBGYN to give us some answers on, what we were looking at. And of course, I was going down the Google rabbit holes trying to figure it out myself. When I had finally got a call back from my OB, he let me know that it was likely an omphalocele and that I could go to the nearby children's hospital, which is about an hour away from us, and meet with a maternal fetal medicine specialist for a level 2 ultrasound, and that they would probably counsel me on termination. So he let me know that they wouldn't put that referral in and they would not see me until somewhere around 16 to 20 weeks. And I pretty much begged them to get us in sooner because I could not go another 8 to 10 weeks without having any idea, what was going on. So at about 12 weeks, we went for our level 2 ultrasound with the MFM, which is the same appointment where we were diagnosed with a giant omphalocele. At the time, they couldn't tell exactly what was in it. They did see the liver, but other than that, there wasn't really much information they could give us as far as what it contained. So from there, what they had us do was schedule an amniocentesis, and everything came back clear from that, thankfully. And then shortly thereafter, we got our 20-week anatomy scan, which was a breath of fresh air for us because after what felt like a few weeks of not knowing, how extensive our son's case was going to be, we were very hopeful leaving that appointment because they had said that the omphalocele was isolated. And they had sent us at that point 2 weeks later at 22 weeks for a fetal echo, just to be on the safe side. Our MFM did tell us at the anatomy scan that his heart looked great, but unfortunately, when we went for the fetal echo, they did find a small VSD. And then we were referred to fetal cardiology a few weeks after that. They confirmed they did see the VSD on the echo. And then from there, they kind of just said it was a wait and see what happens. And hopefully they said it would either close on its own or not require any intervention once he was born. So from there, we went for weekly BPP ultrasounds. Every time, we went, Elliot looked great. We had a scheduled C-section at 39 weeks on November 24th. And he came out screaming. They weren't really telling us much. It felt like forever once he had, been born that they were giving us any information, but I could hear them talking in the corner of the room while he was being assessed. And they had given him an APGAR score of 8 out of 8. So I knew at that point that he was doing really well if his APGAR score was, as good as they had said. So they showed him to me and my husband for like maybe 2 minutes. We got to take a few pictures, and then they took him straight to the NICU. And from there, he did really well. He never needed any respiratory support. He started out on 3 milliliters of donor breast milk and unfortunately could not tolerate that. So he was pretty much vomiting right after the feed, vomiting a few hours after the feeds. And this is with no compression. His belly just had a dressing on it. And from there, they decided to stop feeds. They put in a central line, and then he was on TPN nutrition for almost the majority of our NICU stay. We were pretty hands off in the NICU early on. If I could go back in time, I think I would try to be a little bit more aggressive as far as the things that we were able to do. We were very intimidated. Our NICU setup was a pod setup. We did not have our own room, so I kind of felt like we were constantly being watched. We didn't feel comfortable taking him out of the warmer on our own, and we didn't really push to ask either. So if I could go back and do anything differently, that's what I would do. But I was also still, recovering from surgery as well. So from there, he spent 26 total days in the NICU, and we did not do any compression during that time because he was having a very tough time tolerating feeds. We started again at 3 mLs every few hours, and he just couldn't keep it down. His suck, swallow, breathe reflex was great. He was drinking from the bottle great, but he just could not tolerate it. His belly was very bothered by anything coming in. So it took us a few weeks to work up to full feeds and some fighting with the surgery team on my end to give him an NG tube instead of doing TPN because he had a central line in his head and it made moving him around very difficult. There was a big risk of infection. So we pushed for the NG, which they had finally given to him the week before we were discharged. And that's really when things turned the corner. He got the NG, started eating great by mouth, and we were discharged after 26 days. And I think he was on the NG for about 7 days. And he went home on full feeds, fully by mouth. So from there, we did dressing changes at home. He was born with, I would say, almost 50% skin coverage, which we were all pretty surprised about. So he had full skin coverage by about early February, which was a lot sooner than we had thought given his late November birthday. And then from there, the biggest struggles, like with any O baby, is, getting them to eat a lot and getting them to gain weight. So he's our little boy. He is not on the growth chart. We are followed closely by a pediatric nutritionist. And he, right now, again, still on full feeds by mouth, he is on fortified breast milk, fortified to 24 calories. And then other than that, he pretty much lives a completely normal life. He's going to be traveling quite a bit by airplane this summer. And he recently got a helmet, unfortunately, but that was not as big of a deal as I thought it would be. He did have a one-sided preference from having a central line in his head in the NICU. They were always turning him to the opposite side. And unfortunately, that preference continued once we got home, even with pediatric OTs coming in. We unfortunately could not break the habit. So right now he meets with early intervention monthly, but he is meeting milestones as normal, just started some purees and solids. And like I said, pretty much living a completely normal life. You'd really never know anything was going on with him. And the surgery team is hoping to meet again this summer to decide a better trajectory on when they'll do a full closure surgery. They're hopeful that it will be just one surgery and that'll be it. But they're going to take the more conservative route. So if they don't feel he's ready around his first birthday, then they'll wait until, they feel he's bigger and has more muscle to do a full closure.
He sounds amazing. Keep us posted on the surgery. It sounds like you've been a wonderful advocate for him as well.
Thank you.
All right, Corinne, let's hear from you.
Hello, my name's Corinne. Me and my husband, we live right outside Charlotte, North Carolina. Our O baby is 16 months. He was actually our first IVF baby. So he was a miracle from the beginning. So funny thing about him is I actually am an ultrasound tech. So with having IVF, I scan myself probably once a week. And about 10, 11 weeks, I scanned myself immediately, knew what it was. I messaged my OB and they got me in that afternoon. And they did another scan. And of course, they said, yep, it's an omphalocele. So I went back to my maternal fetal medicine, which is the same as my IVF doctors, which was kind of a blessing in disguise because they were wonderful and we all knew each other. I went for my first appointment alone. I told my husband there was no point in him going. It is what it is. I decided to go ahead and do my amnio that day. And it was an isolated O. I We scheduled a C-section for 38 weeks, but I was preeclamptic and everything just started going south. So I delivered 36 weeks and 5 days. And we were blessed. Our NICU lets us take a tour. We asked all the questions, very comfortable. So when we delivered, my husband walked with Granger down to the NICU, met all of his nurses, did his cares, and then he came back up to see me. I was not able to see him for 36 hours in person. And then I finally got to go down, and we did not hold him until day 4, which is when I got discharged from the hospital. He was doing great. He was intubated for a week, and then I was readmitted to the hospital. So my husband and parents took care of him in the NICU while I was upstairs again. And at 3 weeks, he started with a bowel obstruction. We weren't positive it was a bowel obstruction, did all the x-rays, everything, but with the giant O, you really can't see very well. So finally surgery, which we had met with them prior to delivery, just about his O, said they need to go ahead and to explore and see what was going on. That surgery turned out to be like 5-6 hours, and our surgeon came out wonderful. Things did go well. They did take 6 centimeters of his bowel out, but they were able to partially repair his giant O. So now it's just his liver that hangs out. He did have almost complete skin coverage before this, so it felt like a step backwards. But he went on the oscillator vent that night. Things started to go south, and 3 days later, he was back on his high flow oxygen. And we spent 117 days in the NICU. A week before discharge, he decided he no longer needed oxygen, and he ripped it off and would not let them put it back on. So we came home without oxygen, but we did come home with a G tube. Our hospital actually does not let their patients go home with NG tubes. They were going to let us, but he did not take enough. They required them to take at least 70% by mouth, and he just wasn't there. So we went home with a G tube at 4 months old. He came home, did all the things. He just started eating. We did a wean program in January. So he has not used his tube for full feeds since January 22nd. That's our excitement. He is still very tiny. He eats all the time, but he also runs around all the time. And we are climbing everything, doing everything he's supposed to. We are not having our finished surgery until either the end of this year or beginning of next. They want him bigger, and because it's just his liver and there's not really a bump anymore, they're not too worried about it. So yeah.
Thank you, Corinne. I think your diagnosis story is like 1 in a million.
It honestly, it sounded scary to everyone else, but it kind of comforted me knowing that I found it and it wasn't a complete shock.
Yeah, that's amazing. And congratulations on the tube weaning. That's incredible.
Thank you.
All right, Ashley, last but not least.
Hi. So my name is Ashley. I'll just preface that I'm also in Canada, so hi to the other Canadians that are here. So I'm actually in Newfoundland, which is a fairly small province in Canada. And we do have universal health care here, so that kind of changes the story a little bit. So this was my first pregnancy as well, at 37 years old. And I was sick for like the first 3 months, like, really sick. And I had my 10-week scan and they had not detected anything. And then here we go for a 20-week scan, it's full anatomy scan. And that's when my friend was a week ahead of me. And I had told her, oh, like, I'm really nervous about my scan on Wednesday. And she goes, oh, don't worry, nothing bad will happen. If something bad, like the doctor will come in. And so what happens is the radiologist comes in and I start to cry. And he very coldly told us that our baby had an omphalocele. We had never heard the word before that day. So Andrew, my partner, kind of had to get him to spell it out so he could start Googling it. So of course we went home and cried all that night and Googled, went down that bad Google hole. But I did come across the Old Warrior and the Mothers of Omphalocele page, which gave me a little bit more hope. So then we referred to MFM, and our MFM was lovely and hopeful. And we wanted all the facts. So we went ahead and had a fetal echo done, a very comprehensive ultrasound, MRI, and amnio. All of that came back clear. So the same thing, it just seemed to be an isolated omphalocele. So we had a really good prognosis. We met with a surgeon, we met with the NICU, and we decided to proceed with the pregnancy. We were offered termination as well. And in our province, you have till 22 weeks and 6 days to terminate. If you want to terminate past that for medical reasons, I would have probably had to go out of province. So, if anyone has ever considered that, don't feel guilty. It's part of the journey. And we definitely weighed heavily on our decision. So our baby had liver, partial bowel, and partial stomach. So then we got a biophysical every 2 weeks from the MFM. And then around 28 weeks, our baby developed ascites in the abdomen and in the omphalocele itself. So like kind of a crescent-shaped moon. So then they monitored me more closely every week. And then it became every fluid grew. So then it became twice a week towards the end. And it was summertime and I was due at the end of August and everyone was kind of doing their vacations, our OB and our MFM and everything. So we wanted to line stuff up, but my water ended up breaking at 35 weeks. So I had a emergency C-section, even though I wasn't having any contractions. The C-section went really, really great. I highly recommend. It was in and out. The room that I had my C-section is connected right to the recovery room in the NICU. So, because our adult and children's hospital are connected. So we got to see her shortly after, and we found out that she was a girl. All those scans, we kept the gender secret. We were originally told pain and weight when we had met with the surgeon at 20 weeks, but he ended up being on vacation. So we ended up getting another surgeon who was, apparently the best surgeon there. So while I was down in recovery, he comes up to me and says, "I think I can fit that all in today." So she ended up getting what they call a silo, or the Schuster method. So she had a silo placed on day 1 of life. And that was really hard, seeing her connected to the ventilators and on all kinds of paralytics. So she was essentially in a coma and very puffy. And then she, with her organs above her, like I've saw her organs in this kind of sac. And then they did full closure on day 8. We were told that she had a tilt of heart in utero, but that ended up being not a thing. And so the ascites ended up being a non-issue as well. In fact, the ascites was actually a good thing because it made room in her abdomen for her organs to fall back in. She also had a lot of skin closure there as well. So they were actually able to do full skin and full fascia closure on day 8. She was on the ventilator for just that while and for a little bit after the surgery. And then she came off the ventilator beautifully and was on just a little bit of oxygen support for a couple weeks after, but then slowly weaned off that. We were in the NICU for 67 days. The hardest part of the journey that kept us there was feeding. As most old moms will tell you. She still at 10 months has her NG tube. Our hospital let us go home with the NG tube. It's been a road. She's, 3rd percentile, very tiny. She's kind of had that little miracle moment where she started to drink through a straw in the last 2 months. So we were headed down the G-tube path, but now our surgeon is confident that she can come off because she's at about 80% intake. We've had some setbacks with teething and sickness. We're followed very extensively by our team. We see our surgeon all the time. He's very experienced. He was been a surgeon for 30 years, and he said it was the biggest omphalocele he'd ever seen. So Audrey has lots of people's OT, dietitian, audiology, all this kind of perinatal following. If I could give any advice to parents, it's that, we'll settle into a routine when you're in the NICU. We always had family around that made sure our fridge was stocked. We read her bedtime books. I pumped the whole time. It did feel sometimes like she belonged to the nurses. and I was just boring her, like kind of what Christina said. Other advice I would give would be to engage in therapy. I found that beneficial before I delivered, and now that the dust settled, I'm kind of getting back into it to get through some of my PTSD. The sweater that I had on the day of the 20-week scan, it's this bright blue sweater, and it's still in my closet. I have not been able to wear it ever since. So I've kept it just because I want that to be something that I overcome. I will say also it's great to connect with other moms. Like I talked to Corinne, I've talked to other moms that babies were born around the same time or have had similar issues. And I just find that has been a really good source for me through the O Warrior and the Moo page. I do find it beneficial also to be doing these kind of things like speaking about it, or I've done some things to help out at the NICU at my local hospital, and that's been healing for me. And my last piece of advice would really be enjoy your pregnancy. That's one thing I feel like I didn't do enough of. Like people would see me pregnant and I would just like, I would verbal diarrhea onto them sometimes. So I enjoy your pregnancy and have that shower. The best thing I ever did was have my baby shower, and it allowed me to feel really normal. And I asked people, I said, no clothes, we don't know the gender. And that kind of helped out. And I had all the normal things on my registry, but that was a really happy day that I'm really glad I did.
Thank you so much, Ashley. Your little one sounds amazing too. And you are a super mom. Thank you for being here. All right, let me stop the recording.